So good morning all. My paper for today is on knowledge, attitude and practice pattern among ICU nurses on eye care practices in ICU patients. Here are the contents. Eye care forms a major part of care provided to all patients in ICUs. Critical care nurses have limited knowledge about the anatomy and physiology of eyes, and ocular manifestations in critically ill patients may lead to a delay in the identification and delivery of proper eye care. My objective is to estimate the knowledge, attitude, and practice pattern of nurses regarding the eye care in patients admitted in the ICU in a tertiary care center. A descriptive study was done among ICU nursing staffs using a well-structured questionnaire. A total of 74 nurses were included in my study. Participants' age, education, gender, experience in critical care, type of ICU, and previous eye care training was noted. Data was collected in the form of a questionnaire. It had 3 parts: knowledge, attitude, and practice, with 7 questions in each section. The questions on knowledge assessment were on different ocular signs in the patients, their risk factors, and management with 2 or more correct response. A score of 3, 2, 1, and 0 was given respectively, and the participants were grouped into based on their score into 3 parts: good, average, and poor. Now, questions on attitude were based on the importance of early detection and treatment and prevention of eye disease. Positive response is given a score 1, and negative response is a score 0. Depending on the total score, attitude was again graded into good, average, and poor. Practice was based on the technique and method of eye care practiced by the nurses in the ICU, and again, based on the scores of practice pattern was again graded into good, average, and poor. Statistical analysis was done. Now moving on to the results. 74 nurses, ICU nurses were included in my study. The mean age was 33.7 years. 92% were females. 93% were BSc graduates, and 35% underwent eye care training. 54% had 1 to 5 years experience in the ICU, and 20.3% were from the neurosurgical ICU. 78.3% of the participants had an average knowledge, and most of the participants answered saying that ICU patients were at a higher risk for exposure keratopathy. That's, as you can see in the bar diagram, it's 86.48%, and least knowledge was for the question on reasons for developing exposure keratopathy, that is 54%. 50% of the participants in my study had good attitude. Out of the 7 questions under attitude, maximum positive response was for the question on the effective care of eye care in preventing eye disorders, and least response was for the question on what will be done on seeing a patient with incomplete eyelid closure. There was no significant correlation between knowledge and attitude score, and the majority of the participants had an average practice pattern. Maximum response was the question on last assessment of lid closure, and least response is for the question on the method of cleaning the eyes of the ICU patients. 66% of the participants assessed the eyelid closure in their last duty. 59.5% of the participants assessed eyelid closure hourly, and 37% instilled eye drops 3 hourly and 6 hourly respectively, and 41.9% responded that they used distilled water to clean the eyes of the ICU patients. 50% of the participants cleaned the eyes hourly. 60% performed lid taping for incomplete eyelid closure, and 60.8% of the participants followed a fixed protocol, of which 28.4% of the participants said that they got the protocol from their seniors or colleagues. Now moving on to the discussion. 93% of the participants were BSc graduates. 35% have undergone eye care training. Majority of the participants had an average knowledge. 50% of the participants in my study had good attitude, and majority were having an average practice pattern. So in our study, we observed that both participants with good and average knowledge showed a good attitude and an average practice pattern, and there was no correlation between knowledge and attitude. Similar to our study was another study by Khalil and et al. In contrast to our study, a study by Mariam et al. Showed a positive correlation with good knowledge and attitude, and a study by Ebedi et al. Showed that the study participants had limited knowledge but showed a positive correlation to attitude. Majority of the staffs assessed the eyelid closure in their patients in their last duty, and 60% performed lid taping for incomplete lid closure, similar to a study by Aditi et al. In a study by Sonal et al., less than quarter nurses responded that they were unaware of the high potential of exposure keratopathy, and only 50% of the nurses checked the eyelid closure and took steps to prevent the exposure keratopathy. And an awareness protocol coupled with awareness programs can improve the knowledge. Now, post my study, we had conducted an awareness class to improve the poor knowledge and attitude. So here is our new protocol that we brought up. It had grades 0, 1, and 2, treated based on this grading. Treatment was done based on the grading. And to conclude, ocular complications occur in a large number of ICU patients due to lack of awareness, which leads to a delay in the identification and management. A clear protocol can improve the quality of the eye care in our staffs. Here are my few references. Thank you. Ma'am, yes. Ma'am, we given them a score for like we had given one score for positive response, and if they didn't do the right didn't do that, we gave them a score 0. Just 1 and 2 was the scoring for that. 1 and 0. Attitude. Ma'am, attitude was we checked on how were they doing that particular, like, for effective eye care on preventing disorders. How did they do? Was it high? Was it moderate? Or was it low? We graded based on that. If it is high and very high, we gave them a score 1. If it is moderate, yeah, ma'am. Attitude. How would they would, yeah, ma'am. How attitude, ma'am, towards, ma'am. Yes, ma'am. Yeah, ma'am. Yes, sir. Yes, sir. We do have. Okay. The question is not this. I just it is. Answer. This is the question. Yes, sir. If it's yes or no, yes, sir. And for, yeah, yes or no, and if it's high and very high, we give them a score 1. And if it is moderate or low, we give them a score 0, based on their attitude. How did they treat the patients? Yes, sir. We did conduct a awareness class, and we did introduce our protocol, sir, ma'am. Staffs, ma'am. Diploma, yes, sir. BSc staffs were, and higher, and there were more BSc nursing staffs as well, and who had more experience. They practiced the protocol more than the rest of them. Thank you.
See, every competitive free paper session, you will generally hear judges saying that it was very difficult to assess. It has become a cliche, but it's a fact here. I mean, all of you, of course, when we ask questions, you might feel that, oh, the candidate didn't do well, but it was only to bring out the impact from your study, and also to bring out how much you understood what you were doing and how you can implement it when you grow as a faculty in your practice. But all of you did extremely well. The questions, the study, the level of involvement was excellent. So congratulations to all of you.
Just like to put that none of our questions are meant to discourage you, just to show you what is important. I mean, your research question, your observations, and your conclusions should be put together. We all know that you are just doing a study, and that is part of your thing. You will be learning, but remember, those conclusions have to correlate with your research question. You are finding out something, so we need to know the answer to that question. So it should come out like that. That's all. Otherwise, all of you have done well. And congratulations and best wishes. You reached the final. That itself is a very good part.
So actually it is for you to learn how to do a scientific study. So when you do a thesis, it is not the results you is not important. You learn how to do a scientific study. Those things you should continue in your profession later.